Have you been at the end of the road before because you could not pay your premium? Have you been denied coverage because your healthcare provider is out of the network of your healthcare insurance and you must pay all the bills out of your pocket? Have you lost your healthcare insurance because you lost your job and your healthcare insurance is attached to your job? If answers to these questions are yes, then you want to lend me your ear for the next 6 to 8 minutes. First, I want to talk about the Affordable Care Act. According to Lawrence Brown, the Affordable Care Act has assured a landmark in United States healthcare reform and a landmark in United States social policy legislation. But nearly 10 years after its passage, few would deny that United States healthcare system has plenty of room for improvement. Before the Affordable Care Act, over 20 million people are either uninsured or underinsured. The insurance company can deny an individual with pre-existing condition. Being pregnant is considered a pre-existing condition at the time. Affordable Care Act has some sources, but we cannot overlook its lapses, and that is why a lot of people are talking about single-payer healthcare system. Now, let's look at what single-payer healthcare system actually looks like. According to Donnelly, Hewin, Grogan, and Fox, single-payer healthcare system refer to a system that is financed by a single entity. That single entity is usually the government. The government is the payer for the service, and such payments are financed by the taxes. That means if we are to use a single payer healthcare system in this country, people are going to pay more taxes. But I believe people will not hesitate to pay more taxes if the quality of the service remains the same or improved, and the accessibility to the service is also improved. Let's look at my family healthcare expenses in a year. The government gives my family $500 credit per month. That's sum up to $6,000 in 1 year. I still need to make a premium payment of $72. If I have a prescription drug, I'll pay some certain percentage on those prescription drug, and total of $2,000 out of pocket in 1 year. So when you look at my family expenses, the government is already paying $6,000 to help my family, while I'm paying about $4,000 in estimation for 1 year. So if the taxes is increased, I believe I won't be paying up to $4,000 in tax increment if we are using single payer healthcare system. Single payer healthcare system sounds good and it looks good on paper, but it will not be adopted without facing its challenges, maybe from state's constitution or based on political ideologies. According to Michael Sproul, single-payer advocates may face unexpected resistance from presumed political allies based on idiosyncratic provision in state constitution. For example, both Planned Parenthood and NARA Pro-Choice America opposed 2016 referendum in Colorado because the state constitution banned public funds for abortion and reproductive right advocates fear the initiative will eliminate the access to abortion for women now covered by the private healthcare system. So presently, the Affordable Care Act covers Planned Parenthood, but with this Constitution of Colorado, if we have a single payer healthcare system, then Planned Parenthood will not be covered. But I want to look at it from this perspective that irrespective of your political spectrum, we all deserve quality, equality, and accountability in our healthcare system. How can we maintain single payer healthcare system? According to Greer, German, and Donnelly, middle classes are crucial. If they feel the public system are desirable, they are the reservoir of support for the basic concept of the system and a large pool of engaged users who can fairly quickly tell when it is deteriorating and exert influence on the government of the day. So if we are to maintain the single payer healthcare system, if there is ever one, then we have to carry the middle class along, because if the system does not favor the middle class, they can exit the system and the system will collapse. In conclusion, I have discussed the concept of affordable care health. Affordable care health is a good start, but it has its lapses, and its lapses has been exposed, especially during the COVID-19. I also discussed what single payer healthcare system looks like. A single payer healthcare system is a system where everybody is covered and have equal accessibility. I also discussed the benefit of single payer healthcare system and the challenges that it can face. With the single payer healthcare system, everyone will be under the same coverage with the same insurance card and benefit. Lastly, I explained how a single payer healthcare system can be maintained. It was determined that the middle class are very essential to maintain single payer healthcare system.